Welcome to Imaging at Olympic Park. This new state-of-the-art medical imaging and treatment facility has been optimized for diagnosing and treating conditions of the musculoskeletal system. This video will briefly explain what we do for an ultrasound-guided injection of cortisone. What we do. There are many ways to treat conditions of the musculoskeletal system. Your doctor has recommended an injection of cortisone. Cortisone is a powerful anti-inflammatory and pain-relieving medication that has been used to treat patients successfully for many years. Cortisone has an important role to play for inflamed joints, tendon coverings, and bursae. Bursae are potential spaces that can be seen mostly around joints that can become angry, and this condition is known as bursitis. Why we do it. Firstly, a diagnostic ultrasound will confirm your doctor's suspicion of an inflammatory condition, assesses the severity, and exclude other causes. Secondly, we use ultrasound to guide the needle tip into the precise spot where treatment is required. Precise delivery of cortisone will maximize its effect and avoid any potential complications. How we do it. Our sonographer or nurse will call you through to the ultrasound section of the department where you may be asked to change into a gown depending on your type of procedure. Our nurse will ask some questions regarding your medical history and allergies, discuss the small risks and possible complications. Complications of an ultrasound-guided cortisone injection are uncommon, but do include bruising, infection, and local soft tissue injury. Rarely, facial flushing can occur. It is not serious, and this almost always settles down within a few days. You'll be asked to sign a consent form. An ultrasound is a safe and painless exam. The sonographer will place a small quantity of ultrasound gel on the skin. He will then scan the area of concern by applying light pressure to the region of clinical concern. A doctor trained in ultrasound-guided injections will be called upon to perform the injection in a safe and careful way. He will select the needle size, type and quantity of cortisone, and the manner in which to perform the injection. The injection will almost always involve the administration of local anesthetic. The injection typically involves penetrating the skin with the needle, and there is a stinging sensation as the local anesthetic is injected. It will take a minute or so for the local anesthetic to work. The cortisone is then injected. Infection control is important to us, and we make sure the procedure is done with a sterile technique. Our facility and technique are compliant with and have been approved by the Department of Health Services. After my injection. After the injection, you'll be asked to remain in the department for a minimum of 15 minutes. You'll be given a drink and something to eat. It is recommended that patients rest comfortably for the rest of the day and not engage in physical activity for the following 24 hours. The local anesthetic can last for up to 8 hours. Patients often feel numbness or heaviness. When the anesthetic wears off, symptoms may return until the cortisone becomes effective. The cortisone typically takes up to 5 days to work. It is also important to follow up on your doctor's instructions, also regarding your rehabilitation program and follow-up. Complications are uncommon, but should they occur, please contact Imaging at Olympic Park, your referring doctor or general practitioner. Thank you for attending Imaging at Olympic Park. We hope your ultrasound-guided injection is successful. Remember, if you have any questions, please don't hesitate to ask.